内防反弹。毫不
to prevent importation and prevent domestic resurgence, consolidate our achievements and avoid backtrack. On May the 7th meeting of COVID-19 Response Central Leading Group, Premier Li Keqiang put forward clear requirements. We must summarize and leverage the achievements and the experiences from the previous efforts, normalize and regularize our prevention control measures. The Joint Prevention Control Mechanism of the State Council has issued guidance on the implementation of normalized prevention control measures. Today, we have with us Inspector He Qinghua from the Disease Control Bureau of National Health Commission, Chief Epidemiologist Mr. Wu Zunyou from CDC, Director of Environment Research Institute of Xu Xiaoming from CDC, Researcher Feng Luzhao from Infectious Disease Department of CDC to take questions on the normalized prevention and control measures. First, I'd like to give you the updates on the pandemic in the 24 hours of May the 12th, according to reports from provinces, cities, and the Xinjiang Production Construction Corp. New confirmed cases 7. 6 cases were domestic cases detected in Jilin. 1 was an imported case in Shanghai. There was no new death. New probable case 1. It was a domestic Jilin case. On the day, newly cured and discharged from hospitals 18. Close contacts that were removed from medical observation numbered 455. On the front of imported cases, remaining confirmed imported cases numbered 64, including 3 severe cases. Remaining probable imported cases numbered 3. Cumulatively confirmed cases 1,692. Cumulatively cured and discharged from hospitals 1,628. There was no death case among imported cases as of 24 o'clock May the 12th. According to the reports from provinces, cities, and Xinjiang Production Construction Corp, remaining confirmed cases 104, including 10 severe cases. Cumulatively cured and discharged from hospitals 78,189. Cumulative deaths 4,633. Cumulatively reported confirmed cases 82,926. Remaining probable cases numbered 4. Cumulatively traced close contacts 737,901. Close contacts that remained under medical observation 5,317. New asymptomatic infections 8, including 1 imported asymptomatic infection. There was none of them that were transferred to confirmed cases. 18 were off medical observation. 750 asymptomatic infections were remain under medical observation, including 37 imported asymptomatic infections from Hong Kong, Macau, and Taiwan. Cumulatively reported confirmed cases 1,532, including 1,047 in the Hong Kong SAR, 45 in the Macau SAR, 440 in the Taiwan region. On May the 12th, new domestic confirmed cases 6, all were related to the previously detected cluster cases. The domestic cases have been kept stable. However, we are still faced with the risk of sporadic cases that are related to cluster cases. We must keep a vigilant eye on the potential revival of the cases and prevent any spark that may ignite a new fire. Now we'd like to take questions from the floor. Please ask questions on today's topic, and please identify yourself before you ask questions. Journalist from the first row, please. Thank you. With Chengdu Red Star News. As domestic prevention and control results have been consolidated, we have shifted from emergency response to normalized prevention and control. Netizens are interested in when the cinemas, theaters, and other recreational and cultural facilities can be reopened, and how should we protect ourselves? What should be the safeguards adopted by these cultural recreational facilities? Director Shi Xiaoming will take the question. I'd like to take the second part of your question as to how should cinemas and theaters get prepared. Normalization of prevention and control doesn't mean that we are going to the business as usual. In China, in certain regions, there are still the risk of recurrence. After we have shifted emergency response to the normalization of prevention and control measures, we open cinemas and theaters based on certain conditions. In particular, we look at the risk zoning and the category of the facility. In the low-risk zones, the opening of cinemas and theaters should do 6 things. First, be well prepared. Before the reopening, disinfectants, masks, and other supplies must be in place. Emergency response plan must be in place. The health monitoring over staff should be institutionalized. Besides, there should be a dedicated zone for the storage of emergency response supplies. Staff should be trained to do proper disinfection and sanitation, ventilation of the public places. Second, an online appointment or the online pre-sale of tickets should be in place. And if the visitors are already in cinemas, the purchase of tickets should be contactless. Customers are encouraged to pay in a contactless way. If they are in the waiting area or at the counters, physical distance at least at 1 meter must be recommended. And we should stagger the visits. The seating arrangement should keep a physical distance of at least 1 meter so as to expand the distance among people. At the entry and exits, at the entry of the cinemas and the theaters, temperature monitoring must be conducted across all the customers. Fourth, cinemas and the facilities must regularly clean the public items or the items that are most frequently touched. Disinfection and sanitation must be carried out, and there should be a log recording the sanitation disinfection practices, including the corridors of the cinemas, the armchairs, and also the 3D goggles. Fifth, if central air conditioning is used, we must ensure it is operating smoothly. The free air must be initiated. After the daily business is closed, the ventilation, disinfection, and sanitation must be reconducted. Sixth, the staff working in cinemas and theaters must wear masks and ensure their personal protection. Good hand hygiene must be practiced. So these are the measures for the cinemas and theaters in low-risk zones. In the cinemas and theaters of the higher risk regions, we suggest the delaying of business reopening.
That's my response to your second question. As my response to your first question about personal protection. For individuals, we believe 4 points are very important for personal care. The first point is priority should be given to online ticket sales or on-site QR code scanning way of buying tickets. So when you are buying something on site or you are buying some tickets on site, you should keep 1 meter different distance from others. The second measure is to avoid touching any surfaces of public equipment in the cinema, and hand hygiene is very important. Frequent hand washing and hand sanitizer should be promoted, and you can also use hand wipes, and you should perform respiratory etiquette. The third measure to be adopted is to wear mask or bring the mask with you. When you have close contact with other person, within 1 meter contact with other person, you should wear a mask. The last measure to be adopted is to avoid dating with friends. You should go on yourself, or you can go with your family member to the cinema. In the cinema, you should avoid chatting. You should reduce clustered conversations. Thank you. That's my answer. Thank you for your response. Now we have further questions. On the first row, the lady journalist. Thank you. I'm from China Radio International. I would like to ask a question. The Joint Prevention and Control Mechanism of the State Council issued a document guiding the normalized response. I want to ask, what is the principle of a normalized response? Does that mean that we have to be prepared for a long-term fight against the virus? And how can we handle this normalized response? Now the floor is given to Mr. He, Tsinghua. Thank you for your attention given to this normalized response. Our war in Wuhan have achieved a victory, and nationwide we have achieved a big victory also. And the epidemic control have transitioned from emergency response to a normalized response. How can we be prepared for this normalized response and to implement well the State Council and the CPC Party Committee's instruction about the balance between epidemic control and economic development, and in line with the agreements of the State Council, the joint mechanism of disease prevention and control have issued the guidance which are shown to all of you. We have come up with dozens of measures on normalized response. I want to share with you some of the key measures, actually 5 measures. Prevention is the priority. Individual hygiene is the normalized response. For example, hand hygiene, 1 meter waiting line, and also wearing mask. These healthy habits can help us to prevent coronavirus, and also it can prevent us other infectious disease. So I hope that this good habit can be a normalized habit in future. We should shoulder the first responsibility for our own health. So you should wear mask at necessary times. So for example, if you are sensitive to light, or if you are sensitive to the wind and the dust, or if you are sensitive to the flowing part of some trees, and you should wear mask. So in normalized response plan, it is said that in closed area within 1 meter distance, you should wear a mask. Otherwise, you don't need to wear a mask now. Second measure is that professional organization should provide protection and control on a normalized basis. Early detection, fast treatment, and effective care will be implemented by those professional organizations, and this will be the jobs of the professionals to have early identification, early tracing, early care, and early reporting to stop transmission. And we identify cases on a yearly basis. This is a higher requirement on the IA testing capability of our professional organizations because virus cannot be seen by us, so we have to have a testing capability. You have to take note that up to now, and many cities don't have seen any cases. Does that mean that we can rest in peace? No, we have to be prepared. We have to prepare our testing capability and monitoring capability instead of to be found unprepared. So once a case is identified, and we should try to draw up the control area and try to have a targeted lockdown. Once a case is identified, we should choose the close contacts. So experts and professional organizations should be utilized to have normalized prevention. Third, we should give priority to key group of persons and key places. So in implementing the prevention measures, shops, supermarkets, hotels, restaurants will be open to the public in an orderly, categorized way, and other places will be open gradually. And we will classify those places into different categories. Well, for elderly homes, schools, and kindergartens, they will be opened gradually, and we should ensure all the response measures are in place for elderly and for young kids, and we should offer guidance to those institutions. Next point, strengthen science and technology support to prevention and control. We will promote the development of vaccine and the development of therapeutic drugs, and we should try to come up with a faster testing assay. And also, we should strengthen the capacity of public and private testing institutions, and the susceptible group of patients should be tested as soon as possible. And we should give a full play to the role of big data, use the health code to have mobility of sick people. And the next is that we should give full play to the role of party committee and municipal government, and all the companies and institutions should be responsible for their employee, and all the families should be responsible for their members. So that is the local responsibility. All the government agencies should be responsible for their employee as well. In this way, we can have a concerted efforts to promote normalized response to prevention and control. Thank you. Now we allow further questions. Please raise your hand on the third row. Thank you. I'm from Economic Daily, and many cities are reducing their risk levels. We are seeing more mobility, and this will bring pressure on case prevention. So I want to ask, up to now, have we identified the antigen and the transmission sources in Jilin, and what are the sources, and how can we prevent scattered cases to become clustered cases? The floor is given to Mr. He Qinghua again. Thank you for your interest in Jilin's case. For Jilin's transmission source, we are still investigating into it. Once we have the result, we will release to the public as soon as possible. At present, the domestic epidemic control is stable and within control. However, I have said just now, in certain localities, because of resumption of work, resumption of school, this may result in new risk.
There is more frequent people movement, social gathering, adding the risks. Besides, the pandemic is still raging across the world. There is the mounting risk of imported cases. Apart from all that, COVID-19 has been an emerging disease. We are constantly deepening knowledge of the disease, and all these have constituted challenges. In Heilongjiang Province, Jilin Province, and the Hubei Province, there have been some sporadic cases. The interagency task force of the State Council have sent a liaison and guidance team to guide the localities to implement the measures, identify the problems, IPC control, and other problems that have been identified must be made up for, and we should make up for the loopholes. And all these remind us as we shift from emergency response to normalized measures. It doesn't mean that we could slacken our efforts. It doesn't mean it is the break time. Rather, the prevention and control must be the ongoing efforts. Prevention and control remain as the prerequisite for our resumption of the social and economic activities. The resumption of business operation, the reopening of schools can never run smoothly without proper prevention and control. If we fail to do a good prevention and control, we cannot realize smooth and healthy social and economic resumption. Therefore, we must be prepared in mindset and in practices. On one hand, we must follow the guidance number 14, guidance on the normalization of prevention controls. It has many detailed provisions. Once any case occurred, we must carry out epidemiological survey, improve the testing capacity, identify the source of infection, and trace the close contacts, scientifically divide the catchment area, and cut off the transmission effectively so that we can detect the cases, precisely manage it, and provide treatment and response immediately for any local sporadic cases. Once there is a case, we must stamp it out and curb it in the most initial stage. Second, we can innovate the patriotic health campaign, emphasize the mindset of normalized efforts. If we are to go to the crowded places and participate in any social gathering, everyone should have a good health habit and a healthy lifestyle as well. Once in a certain community there is a detected case or even cluster case, all the related communities, places, organizations, and individuals must actively and collaborate with professionals to be engaged in epidemiological survey, provide truthful, detailed information so as to do what we should do in the prevention and control efforts. Okay, next question goes to the journalist on the fourth row. Thank you, DG Song with CNR. I have a question on the people at the most risk. The older folks, children, pregnant women, and also patients with chronic diseases. How should they protect themselves? I'd like to ask Director Shi Xiaoming to take the question. Thank you for your concern and care on the vulnerable groups or the people at a higher risk, including pregnant women, people with underlying diseases or chronic diseases. It is fair to say that in the context of normalized prevention and control measures, everyone is suggested to continue their personal protection, being it in the homestay environment or if they go outdoors, being it the habits of seeking doctor help or drug administration, or seeking care. First, we suggest a healthy lifestyle, sufficient sleep, and a healthy diet. We suggest such people continue with health monitoring, engage in appropriate exercises. If they go outdoors for exercises, choose the less crowded areas. Maintain good weight. Second, we suggest such people foster good, healthy habits, including the respiratory etiquette. Good hand hygiene, in particular, children should be educated to keep good hygiene. Do not touch randomly. Do not rub eyes, nose, mouth, and frequent hand washing. Besides, we suggest the frequent ventilation and the cleaning of the indoor environment. Third, when such people go outdoors, we suggest walking or taking bicycle or drive private vehicles. Keep a physical distance of at least 1 meter. Avoid crowded and poorly ventilated places. Avoid unnecessary gatherings. If they go outdoors, wear masks correctly. For the patients with cardiac underlying diseases or other severe chronic diseases, they should get doctor's advice for the mask wearing. If patients go to hospitals, we suggest online appointment in the first place. Hospitals can stagger the visits of patients to prevent the crowding and shorten the slot of waiting time for individual patient. Pregnant women in the previous trimesters of pregnancy with a proper guidance of the physicians and in light of the local risk zoning, they can appropriately arrange the intervals of pregnancy checks. For the patients with underlying diseases and the chronic patients who need long-term drug administration, they cannot pause the use of drugs arbitrarily. Rather, they should get a doctor's assessment and ask for a longer prescription and a bigger distribution of drugs so as to shorten the visits to the hospitals. For the older folks with disabilities and for the carers to the vulnerable people, they should also conduct a good personal health monitoring, maintain good hand hygiene, and foster good health habits. Of course, the management and caring nursing facilities should adopt comprehensive prevention and control measures as well. Thank you. Next question goes to the journalist on the second row, please. With the CCTV, apart from the key workplaces and people most at risk, there are also concerns on the exhibitions and conventions. Some say that there were meetings that have been missed in the previous months, and we should make up for what we have missed. Can these postponed meetings be held? And how should the attendees ensure a good personal protection? I'd like to ask Chief Epidemiologist Mr. Wu Zunyou to take the question. Yes, it is a common concern as to whether the meetings that have been postponed can be reopened. Most places in the country belong to the low-risk region. In the low-risk zones, meetings can be held. However, with the prerequisite of sound prevention and control measures, meetings that can be conducted online should prioritize the choice of online conferences, and the meetings that do need the gathering of attendees, the number of attendees And the scale of the attendee cannot be limited. It depends on the ventilation of the meeting venue.
So the deciding of the meeting relies on the places. How long will be the meeting, and how large will be the meeting group. So it's best to have a short meeting, have a limited number of people participating in the meeting, and also you should encourage ventilation in the meeting room. And between meeting participants, there should be distance. And in catering process, you should follow the guidance. In convention and exhibition, it is also the same. In exhibition room, it should have a proper ventilation and a proper disinfection procedures. And also in the exhibition process, the exhibitor and the participants should keep distance from each other. Mask should be worn in the exhibition room. If such measures are properly adopted, it should be said that there is low risk of resurgence of cases. Nationwide, we have low risk of infection of coronavirus, so we can convene convention and exhibitions. Talking about convention and exhibition, after meeting, you will have a group dinner or group lunch. For those group lunch and group dinner, do we have specific requirements and limitation or restrictions? When the risk assessment result is low, group lunch is also okay, but you should try to reduce the number of group lunch and group dinner. It's better to have outdoor lunch and dinner. If you are having dinner within the room, it's better to have good ventilation, and you should not encourage wines and other activities. You should shorten the dinner time as much as possible. Thank you. We allow further questions on the third row in the middle. Thank you. I'm from a New Evening Post. And the new measure expand the testing to wider group of people, and how can we ensure wider testing, and how can we have a better screening of asymptomatic cases? Now the floor is given to Mr. Fang Luzhang. Thank you. About testing, testing is the hot part of attention. Fast testing is a key insurance for early detection. So on the basis of assessing the testing capability for key group of persons, for key places, we will expand our testing scope. In this way, we can have a precise prevention and control and ensure the health of people, and also increase mobility, increase resumption of work. Second, expanded testing will rely on our testing capability, relying on our fast testing capability and technology, and for county and above county level hospitals, and also for customer quarantine organizations, we have to increase their RNA testing capability, and for places with large cluster of people, for port areas, capacity building should be enhanced in those areas, and we should encourage private testing organizations to offer their services to these places. For key groups of persons, we should offer them faster testing so as to identify potential infected patient and try to reduce the risk of transmission. And also for close contacts of confirmed cases, for people suffer from fever, and for newly hospitalized person and their accompanying relatives, we should provide them with testing. And for children care facility and elderly care facility, for prisons, and for port quarantine person, and If there is any clue of suspicion, we will provide testing to them. And also for other group of person, we can offer testing to those people who voluntarily come to the testing. And for school teachers and kindergarten teachers and students from high-risk regions, and also for public transportation services people, and also for people who just arrive at their factories and their plants, we can provide testing to them so as to lower the risk of transmission and ensure safe resumption of work and school. Thank you. We allow further question. On the fourth row, I'm from Phoenix TV. It is reported after resumption of school, 3 students have died because of wearing mask on physical exercise class. I want to know on what occasion we must wear a case, on other occasion we mustn't wear the mask. Thank you for your question. Now the weather is getting hotter, so people are asking whether we should wear a mask. And also some students died because of exercising with mask on. There is a principle that is in places with good ventilation, it is not necessary to wear a mask. If the ventilation is good, then you are safe. To be specific, on what occasions we should not wear mask, I should list those occasions. In outdoor open space like a playground and in park, on street with a scarce concentration of people, you don't need to wear your mask. And also within your home, you don't need to wear your mask. Thirdly, in low-risk area, in workplace like office or working site or factories, you don't need to wear mask. And fourthly, if you are engaged in outdoor sports, you don't need to wear a mask. Fifthly, for middle school and primary school, within school, you don't need to wear a mask. There is a principle that if you are familiar with those persons who have not visited other cities during a long period of time, if you know those person and if they are based in low-risk region, then you don't need to wear mask. In other places, you have to wear mask. These are like poor ventilation. For example, in closed transportation vehicle like airplane, like a train or subway or buses, you should wear a mask. And also in closed places like lifts with poor ventilation, you should wear a mask. On the third place, if you go to hospital or if you accompany a patient to hospital, you have to wear a mask. And also, for people providing public services like clerks at the supermarket or clerks at the counter of a bank, you should wear mask. And the key principle is about ventilation. If you have good ventilation, your risk of infection is very low. So you should not be too puzzled about whether to wear it or not. So in closed area with poor ventilation, you should pay high attention, while in other places, you can decide on your own. On the second row. Thank you, Chair. From China Youth Daily, school prevention and control is attracting public attention. So in school prevention and control, can you introduce us about the specific measures? When many schools are reopened, how can we ensure normalized prevention and control in school? Now the floor is given to Feng Luzhao.
Thank you for your question. Schools are places where there is an intensity of people It is the place where we easily identify respiratory infectious disease. COVID-19 is still raging in other countries. In domestic provinces, there are still sporadic cases. Therefore, in schools, we must keep unrelenting focus on the potential risk of COVID-19 recurrence. After the schools have been reopened, we will pay special attention to the following aspects. First, the schools should have in place an mechanism and institutional scheme for prevention, preparedness plan, and emergency response to ensure all the prevention and control measures are in place can be implemented. Education departments should collaborate with the health commission's designated hospitals and community service centers to set up the coordinative mechanism. Second, there should be a good management of staff and people movement. Temperature monitoring must be carried out among students, the faculty, and for the boarding school students. Monitoring should also be strengthened to monitor in particular the sick leave students and prohibit the sick students and the sick faculty to be on their duties and in their classrooms. There should be control in place to ensure a safe social distancing and physical distancing. Third, schools must conduct the school environment sanitation and health education in the dormitories, in the classrooms, in the washing rooms. The sanitation of the environment must be maintained apart from the regular cleansing. There can also be periodic disinfection for the highly frequently touched public items. The sanitation disinfection should be more frequent. Ventilation should be more often in the classrooms, the teachers' offices, and ventilation should be throughout the day. Both faculty and students should have very good health habits, maintain good hand hygiene, and ensure good personal protection. Fourth, emergency response system must be in place if there are any suspected or probable symptoms. Students and faculty must report to the school immediately and be kept on home-based quarantine or go to hospitals for further checks. Once a confirmed or probable case have been identified, emergency response plan must be initiated with the guidance and the support of the specialized health institutions. Later, emergency response and response efforts should be in place. I'd like to make some supplementary remarks. The journalist is very interested in the campus prevention control efforts, and researcher from Luzhou has responded. Actually, at 3 o'clock, National Health Commission will convene a national video conference with the education departments across the country to provide proper information and to implement the proper prevention and control measures on campus. Because of the time constraint, we have to stop today's press conference, and tomorrow we will focus on the treatment carried out in field hospitals. Field hospitals has been one of the innovative highlights in China, which played an important role to ensure all those that should be admitted could be admitted. The building of field hospitals, the actual work carried out by the health workers, the difficulties encountered by them, and the efforts they made in overcoming the difficulties and saving lives. These are questions of common interest. We will invite health workers, doctors, and nurses who have been working in field hospitals to share with you the information and answer questions. We look forward to your continuous attention. Thank you. I'd also like to thank the guest speakers for taking questions.